Hello all, and good evening. This is Brooke, and I'll be reporting on the Epi News. Today's topic will be centered around one of the most contagious diseases in the world, measles. This fast-paced disease is no joke, and it's very dangerous and spreads very rapidly. Do you know the disease symptoms and how it affects children? Is your child vaccinated? Maybe you'll think otherwise after this segment. Measles is a highly contagious, airborne disease caused by a virus. It spreads quickly when an infected person breathes, coughs, or sneezes. This disease affects our children the most, but measles can affect just about anyone. Measles is an endemic disease globally, meaning it is continuously present in our population, and resistance is through either vaccination or prior infection. What do the measles symptoms look like? So symptoms of measles usually begin around 10 to 14 days after exposure to the virus, with the prominent rash being the most visible symptom. Symptoms include rash on the face and upper neck, runny nose, cough, small white spots inside of the cheek, and high fevers. As there is no exact treatment for measles, it's just important to focus on relieving the symptoms by making the patient more comfortable and preventing any complications. Also, taking a vitamin A supplement can reduce these symptoms as well. So who's at risk and where? Children under 5 are mostly affected, but just about anyone can be diagnosed with measles. Adults over 30 and pregnant people are also at risk. Unvaccinated and non-immune people are also at risk, of course. And having immunity to measles is if you have a past history of measles, then you're protected to a certain extent. Measles outbreaks are most common among refugees. Now where? Measles is common in Africa, the Middle East, and Asia, as this map presents. Majority of measles deaths occur in countries with low per capita incomes or weak health infrastructures that cannot provide vaccines. So the importance of the vaccine. Vaccination is the best way to prevent the causation of measles and spreading it to others. The measles vaccine was introduced in 1963 and has averted more than 60 million deaths between the year 2000 and 2023. This vaccine decreased an estimated 800,062 deaths to 107,500 in 2022 worldwide. Community-wide vaccination is the most effective form of protection. Due to vaccine hesitancy, vaccination rates are lower and the death rates are higher. 1 in 5 unvaccinated people who get measles are hospitalized, and 1 in 3 out of 1,000 children with measles die from respiratory and neurological complications. So should children get vaccinated? The MMR vaccine is recommended for all children to ensure immunization, along with adults too. Children should receive 2 doses, the first dose usually given at 9 months in countries where measles are most common, but 12 to 14 months in other countries. The second dose should be given later on in childhood around ages 4 to 6 years old. The first dose is 93% effective and the second dose is 97% effective. In 2023, 74% of children received both doses of the vaccine, and about 83% of the world's children received at least 1 dose of the measles vaccine by their first birthday. Good afternoon. I'm here with middle schooler Bridget on the issue of the MMR vaccination. Since there's a spike in measles cases in 2024, have schools informed students on vaccination and safety regarding diseases such as measles?
I wasn't personally aware of the spike in cases, so no schools are informing students on this topic. I think it's important to get the vaccination to make sure everyone stays safe.
Are you aware of any screenings or protocols the schools provide if there were a measles case?
I'm not sure. The schools only provide information regarding COVID-19, no other disease outbreaks. I prefer if schools are more open and consider screenings and vaccinations in school for students.
Interesting. I agree. Public schools should provide more information and protocols to ensure the safety of our children. Well, thank you for your time and stay safe.
Thanks.
So the disease history. Measles started infecting humans as early as the 14th century BC. In 1757, Francis Holmes originated the disease measles. In 1912, measles became a nationally notable disease in the US. In the decade before 1963, nearly all children got measles by the time they were 15 years old. In 1963, John Elders created the measles vaccine. In 1978, the CDC set a goal to eliminate measles from the US by 1982. In the year 2000, measles was declared eliminated, although it has made a comeback. In 2023, 90% of adolescents in the US aged 13 through 17 had received the MMR vaccination, In the year 2024, the measles cases total is the highest it's been since 2019 in the US. Where did the disease measles come from? From 2000 to 3000 years ago, a cattle disease split into two descendant lineages, with one being measles. Scientists believe the origin of measles was zoonotic, evolving from rinderpest. Rinderpest was known as a cattle plague. The other descendant lineages mentioned earlier, it was once mostly affected livestock. And Francis Holmes discovered that measles was caused by a pathogen in the blood. He proved this by transmitting the disease to a healthy individual using blood-infected patients and demonstrated that it was caused by an infectious agent. Alright, the effect on the United States. With the uprise of cases from 2019, the elimination status is at risk. Due to the decreasing vaccination rates among kindergarteners, vaccine hesitancy is behind the spike of these cases. Vaccine hesitancy stems from the COVID-19 vaccination. The CDC emphasizes on the vaccine to be given before international travels, and for international travel, the CDC suggests planning ahead of time by receiving the vaccination and educating oneself on the area of travel and the common diseases and infections there. The 1989 through the 1991 measles outbreaks in the United States led to 166 suspected measles-related deaths with a total of 55,457 measles cases. The first 26 weeks of 1989, the start of the outbreak, the CDC reported a total of 7,335 cases, the incidence rate being 3 cases per 100,000. This rate has doubled from the previous year, with a 380% increase in cases over the same time period. This outbreak prompts the need for childhood vaccination coverage rates and the necessary protocols for intense spikes in cases. Forecasting measles. Measles cases and outbreaks are on the rise, not only in the United States, but worldwide. Some vaccination coverage rates falling below 95%. Overall, measles outbreak risk is low to the general public, but although with global cases increasing, risk of outbreaks in the United States are increasing due to the low vaccination rates in some communities. Measles resurgence is not only due to the lack of community vaccine rates, but the social, political, and legislation choices. Measles as a public health threat. Outbreaks are likely to occur where vaccination rates are lower with unvaccinated people within the same social networks and communities. The lack of childhood vaccinations could lead to nearly 49,000 deaths between the year 2020 to 2030. The World Health Organization message. In 2020, WHO and global stakeholders endorsed the immunization agenda in 2021 to 2030. This agenda aims to achieve the regional targets as a core indicator of impact, positioning measles as a tracer of a health system ability to deliver essential childhood vaccines. The World Health Organization defines measles elimination as the absence of endemic measles vaccine or virus transmitted in a defined geographic area for at least 12 months in the presence of surveillance system that has been verified to be performing well.